I really see the blend of coaching and technology being a wonderful thing. Great coaching is this compassionate accountability that we continue to bring into the relationship. And so how that kind of evolves together, I think that'll be really interesting to see. I don't see personally a future where the human coach is irrelevant. I think that will just continue to become more and more important.
In today's conversation, we're going to explore what it really means to protect a profession and why that question has never been more urgent than right now as AI enters the world of health coaching at speed. This is The Edge of Human and AI, a Viva la Coaching podcast. We sit right where coaching meets AI, and we're not afraid to ask the uncomfortable questions. We built this show because the coaching landscape is being reshaped by intelligent systems, and the organizations, leaders, and companies shaping that future deserve honest conversations. I'm your host, Rebecca Rutschman. Each week, we'll help you understand how AI is transforming coaching. We discuss leadership development and human growth across organizations. We will help you navigate the ethical and strategic decisions that come with bringing AI into the coaching space. You'll hear from researchers, innovators, and industry leaders, as well as experts who are reimagining what's possible. Whether you're navigating AI for the first time or already building with it, this is where you belong. Follow us now and join us at vivalacoaching.com. Come stand with us at the edge. I have a wonderful guest today, Deanna Fournier, Executive Director of the National Board for Health and Wellness Coaching. She's a health coach and a passionate advocate for building a profession rigorous enough to earn its seat inside the healthcare system. We will discover why credentialing matters more in a world where anyone can spin up a health coaching chatbot in a minute. We'll explore the surprising truth about accountability, why the data from your wearable rarely changes your behavior, but a human who knows you almost always does. And we'll hear why Deanna believes the coaches who will matter most in this next chapter are the ones willing to ask the question that AI, by its nature, is too agreeable to ask. So hello, Diane, and welcome to the show.
Thank you so much. I'm so grateful to be here, and I'm really looking forward to our conversation. This is such an exciting series.
Before we get started, is there anything that our listeners should know about you and the National Board for Health and Wellness Coaching to frame our conversation a little bit for them, those that don't really know you or the National Board?
Sure. So as you probably introduced, I'm Executive Director with the National Board for Health and Wellness Coaching, and I also am a health coach. But I've been a part of a lot of other nonprofit organization leadership roles, as well as learning and development inside corporations. And so I've seen a lot of the impact and benefit of health and wellness coaching, which is what was so exciting for me with coming over to the National Board for Health and Wellness Coaching, or NBHWC, with an education background and also a passion for coaching. The NBHWC really exists to protect the public and advance the profession through evidence-informed standards, education, and credentialing. And coaching is fundamentally about behavior change, not advice giving. This profession has matured significantly over the last decade, and NBHWC has been tremendously involved in that growth of the profession. And so actually, this coming year, 2027, will celebrate the 10-year anniversary of the organization. And 2017 was the first test administration. So that's when our board exam was the first time that it ever was administered. And so it's really amazing to be a part of this journey. From the very beginning, the organization partnered with the National Board for Medical Examiners because of the fact that helping to establish that credibility and rigor for the field is largely unregulated. And so really we needed to kind of step in and find that opportunity to figure out what are the code of ethics, the scope of practice, and the job task analysis that really frame the coaching profession. And then that board credential is what helps really show that you've met the minimal foundational knowledge and skills for health and wellness coaching. That would say that you qualified professional, especially when we're thinking about working inside the healthcare space. So that's the role that the organization really plays. And the field is growing. Healthcare is increasingly recognizing health and wellness coaching, which is phenomenal. And the board credential continues to be what we see acknowledged on most job descriptions today, which is fantastic.
Because we have a lot of listeners that are probably also from, let's say, the business coaching side of things. And how would you distinguish the two? Like when you look at for example, the ICF and the National Board for Health and Wellness Coaching?
Yeah, that's a wonderful question. So the coaching skill set is very much similar. We utilize a lot of tools to help to bring that sustainable behavior change for their clients. For the health and wellness specifically, it is very unique to walk the journey with someone of moving them through health behavior change. And so that's the distinguishing factor, is some knowledge and awareness of all the different elements of health and wellness. Now, a health and wellness coach obviously is not going to be diagnosing, prescribing, or any of those things. That would be the role of a different provider or professional. However, having the context and understanding of what it looks like to have a healthy lifestyle, what some of those behaviors are that would lead to better health. Those are things that are learned inside the health coach training program. And then the coaching skill set is brought in to really supplement that and really understanding that relationship and how to walk someone through that journey.
So if the National Board for Health and Wellness Coaching didn't exist, what would you be afraid that would happen to the profession in the next few years?
Absolutely. So I know there's a lot of opportunity to really call yourself a coach in what you're doing, regardless of whether or not you have a coaching credential. And so I think regardless of health and wellness coaching, or if you're doing more of the business coaching or lifestyle coaching, maybe through ICF, having a standard and something that is really showing that you are a trained, qualified professional in this field really helps to build that trust and credibility. If NBHWC did not exist, I think that building up some of that trust to really integrate into the healthcare system, especially, but also for individuals that are seeking to work one-on-one with the health coach. Because we're talking about health and wellness, I think that, I know that it is so important to have that credibility and that rigor. And so without that, I think that we would just continue to see people calling themselves a coach, but the trust in what a coach can really do for you when they have that qualification behind them, I think would not be there.
Especially now that we have AI entering our fields, both sides of the profession as well. Where do you see that the importance to really have a strong standing in the market with the NBHWC?
So it's very important for us to be thinking about the ethics when it comes to health and wellness coaching and how to use AI ethically and responsibly, what is inside the scope of practice for a health and wellness coach. So specifically for the coach, how do you use AI? And what we've really seen and I think is really encouraging and exciting is that, AI can really help in a variety of different ways to ease the coach on some of the things that might be administrative. We see that in the healthcare system. We see that across a variety of different places. And when the coach is able to then step in and be able to focus on the relationship and the human aspect of coaching to really build their skill set in that area, and then to lean into AI to help them with the administrative aspects, something really beautiful happens and it really can help to grow the coach and help them to become better. And so I think focusing on how a coach can use these tools and technologies ethically and stay within scope of practice is incredibly important. And so that's a lot of what we're paying attention to and focused on. For example, thinking about if a client comes in and they have a wearable and they have some information that they can share with that, how does a coach engage with their client around that? And then as they're using these different tools and technologies to maybe help them with the business side of coaching, having something that is safe and for HIPAA compliant, for example, which is making sure that you're keeping the client's information safe and protected, that having a platform that is compliant with those standards and those keeps those protections for the client, that's something that a national board certified health and wellness coach needs to be thinking about. So we're trying to make sure that the coaches are aware of some of these things, thinking about these things, and then taking those into their practice, and whether they are using or aren't using some of these AI and technologies.
Because it's also a bit of a challenge in the market now with all the wearables and what, like is actually compliant and what not. And do you encourage coaches to try different tools out to see how they can integrate that successfully into their practice?
Yeah, we encourage coaches to be open. I think that we have to be paying attention to what's out there. Even if they wouldn't integrate into their practice, it's helpful to know what clients might be using and whether or not the information that is being given to them is beneficial. How is that being delivered? What type of information are they getting? And how might they be using it? I think it also is exciting to maybe have conversation with your client around how they're feeling using that technology, if it gives them a sense of control over some of the variables in their health journey. And so the coaches having that awareness is, I think, very important as we continue to see more of these technologies coming around and more people are utilizing them. Additionally, there's a lot of movement towards sort of the digital health platforms where you can chat in for some answers and support. And so coaches knowing how clients might be utilizing those, maybe trying them out themselves just to see what that is like, can really help them understand what differentiates them from those technologies, and really showcase that relationship aspect and getting to know your client really well and being able to help move them through that behavior change, having that accountability. So yes, absolutely encourage them to explore, but then to just make sure if you're integrating into your practice that you're bringing in the ones that are safe for your client and primarily the ones that you're going to be able to help kind of with the administrative side.
And accountable is actually, I think, a very important word. I think you mentioned it in another podcast that you don't really feel accountable to AIs, but I think you're using an Aura ring or something like that. I can't remember. I just tried to listen to it lately. And I think the accountability is something, you get all these messages and notifications, but we're really good as humans ignoring them.
Yes.
So which role do you think the human coach will play in that, let's say, job tasks, like sharing things together with AI in the future?
Yeah. So it sounds like kind of integrating some of these technologies with the coach. There's research that's been done that shows that individuals are much more likely to feel like they are held accountable to another person because you have that relationship with them. And especially if the coach builds that trust right at the beginning and you're working with the client for some time, yes, you might be paying for both the technology and the coach, which can create a little bit of accountability. But when you have an individual looking at you on the other side of a screen or in person saying, how did this go and how did that go? We humans, we want to tell the truth. We don't want to have to say, oh, no, I did that and you didn't, especially that's not going to help you move to your change. And so the idea of kind of integrating those together would be if the client maybe were to use some of that data to bring to the coach and say, here's where I struggled this week. And gosh, the data really showed that my sleep really declined, my nutrition declined. And so I wasn't able to get myself back on track. So I wanted to talk to you a little bit about some things we can do so I can have a better week. That would be a beautiful way to blend some of the data you're getting from a wearable, for example, into your coaching session. And then for the coach to really lean into the human relationship aspect and meeting that client where they are and really helping move them to kind of have a better week next time. And then how did it go? Did you see any different information on your Aura ring? Like that would be just a beautiful way to blend it all together. But we ignore the notifications. We get so many, we're inundated with so much digital information. And I think the more that becomes true, the more important the human connection and human relationship will be. And I think the more important the role of a coach, because you really can meet the client where they are and help move through and ask those questions. I've talked about this before, and this came up at the NYU Coaching and Technology Summit last year, is AI can sense some facial features and be able to tell if someone may be kind of on the verge of tears or something along those lines. But that's something that as a human, we pick up on, even if someone is hiding it. And I'm not sure that technology will get there, where we can really kind of pick up on these nuances in this person that we've gotten to know in our coach-client relationship. And so I think that human aspect is going to continue to be such a huge part of what makes coaching so important.
Yeah, the connection. And then also, if you're held accountable by a human being, it's a different thing than by a device.
Yes.
Yeah, I have so much patience of
Yes.
sitting it out with you.
Yes. Yes.
It doesn't care really if you did your stuff or not. It might ping you, like, oh, you missed entering something, or what did you do today? But that's about it. There's no behavior change, really. Well, when I know my coach is waiting for me at 9:00, I might just really get that thing quickly done or feel bad about it, but I would never feel personally bad about not interacting with my devices or with my little health coach on the device. They ping you too. You can have a conversation and all that, but then it just sits there.
Yes, it's almost how many of us mute it or completely turn it off just because we aren't complying. So I can't get to it. I'm just going to turn it off. Turn off.
Yeah, and then I feel much better. We had it actually that, I'm trying to also manage my son's health at the moment quite a lot. He's on the spectrum. And so we bought him a Fitbit now, just so we can track his stress levels, sleeping time, and all this. I mean, he's 11. But it needs, someone always checking in with him. And it's like, so how did you do, today, for him then to really feel accountable for it? Yeah, I slept well. Yeah, but why do you think you slept better today than maybe yesterday? And what was different? And how can we work on that? And that's something that is still going to stay on the human side, I believe. Yeah.
Yes, absolutely.
What's your favorite device? What do you use?
Ooh, so I have been trying really to move away from some of the devices and really use some of the coaching skills that I've learned along the way with myself, which is, it's so interesting because even as a health coach, you need a health coach because sometimes it's hard to keep yourself accountable.
You can't coach yourself very well. Yeah, maybe to a certain extent, but you can't hold yourself accountable. That doesn't work.
No, that's for sure. But yeah, I've been really enjoying just kind of tracking some of the things inside the Apple iPhone. I've tried Oura Ring. I've definitely tried Fitbit. I've tried Whoop, which I really liked. But I had an iWatch for some time. I'm starting to like not having the screen and then just logging things. And then also some of those meal tracking apps where you can go in and plug in, just see how your macro and micronutrients are balancing out. Those are where I'm focusing right now. So I've kind of reverted a little bit backwards and gone to more of the manual tracking because it helps hold me accountable when I don't have a coach. Where I feel like some of what you just described, some of the other technologies, I wear it and forget it. And then I find myself not checking the data. And so I think being a little more manual for me has been really helpful. But I also still like to write on, pen and paper. So that's probably where that's coming from.
Which is also very important. Yeah, there's a lot of research done on how we connect through writing, also different parts in our brain and all that. So
yeah.
You're doing very well there. I also I had a Garmin for a long time, and then I moved away and I only now use it for running or when I deliberately do sports, and I want to carry my music as well and want to track certain things. But then you get hooked to it, I find, as well, and kind of like constantly checking, or maybe then after a while getting bored about it and not checking again. But I think it can really add, especially when you do want to change something about your behavior, to just use it at least for a certain time to spot certain patterns. We've also talked about the AI's tendency to validate rather than to challenge. It's all over media at the moment. And as a profession that we have, that's really building on asking the hard questions. Where do you think that will lead us in the future?
Yeah. I think that AI tools, they can't replace relational courage and emotional intelligence. I think you have to have discernment when you're growing in discomfort, and discomfort is necessary for growth. And so, ethical coaching really requires that discernment and really helps their clients move through. I think that just from what I'm learning is that AI is trying to learn how to bring in and support that reflection and to really kind of understand what the human aspects of coaching are so that it can build some of that I still don't know that the future is going to have technology that recognizes nuance, resistance, and grief, some of these things that humans can really pick up on. And so, I see a future that continues to blend what we have. I see the future where people can continue to utilize technology to help them with incredible things such as finding a diagnosis for a rare disease that you never might find, or being able to work inside of a healthcare team. I know that as health coaching gets integrated into healthcare systems, there are really amazing technologies that already exist and are being developed that allow a coach to sit on a platform with the multidisciplinary healthcare team, and that all of the information can kind of coexist. And then if a coach encounters a information that they're talking to their client about that they don't have familiarity with, that they can actually jump in and learn a little bit about that in their own time through these closed models. Those are incredible ways to really build on the technology. In terms of being able to challenge and how AI might do that, I personally am curious to see how it will fit that role, exactly like what we described. As much as AI and technology tries to nudge us, I'm not sure that a technology will know how to lean in and really ask that tough question that will kind of read between what the client is saying and what the coach knows might be actually going on, or to really kind of dig in a little bit. You mentioned this last time and the time before. However, I haven't seen any change in that. How does that feel to you? And where can we really lean in together or is that still something you want to pursue? Can a tool pick up on the fact that those things have been addressed in the past and not now? Or will it continue to just acknowledge and say, you're doing great, you ran 3 miles this week, but it doesn't acknowledge that, you were running 5 miles a week for weeks prior? How will that relationship continue to grow? I'm not sure. So I'm curious to sit and watch and kind of observe how this will evolve. And I say all of this knowing that I have seen some incredible technologies inside of learning and development that are helping sales reps and can discern facial features and tell you if you're smiling enough and all of these things. So maybe it's on the precipice, and I just am still kind of hesitant. But I really see the blend of coaching and technology being a wonderful thing. Great coaching is this compassionate accountability that we continue to bring into the relationship. And so how that kind of evolves together, I think that'll be really interesting to see. I don't see personally a future where the human coach is irrelevant. I think that will just continue to become more and more important.
That we become more and more the challengers in the picture.
Yes.
Yeah.
Yes.
The ones that pick it out and are really good at that.
Yes.
Let's move to one topic that I think is also very relevant in the general coaching industry, but specifically in health, even a bigger topic, is that it's still a luxury. Most people have to buy it still privately. How do you think this could change in the future?
Yeah, so NBHWC has been doing a lot of work to not only have conversations on the side of reimbursement, and I can explain a little bit how that connects, but also to connect with employers and to continue to raise awareness about the health and wellness coaching profession. There's over 80 institutions in the United States right now that have integrated health and wellness coaching successfully into their models. And when it's successful and it's structured well, coaching is available and can be something that all patients might have access to. And I think that we just have to, right now, we're in this place where we're still raising awareness and building that recognition of what health and wellness coaching is. We still know that there are people who, when you say I'm a coach or do you know about health and wellness coaching, would not know what that is, and it requires some explanation. And so part of the legwork is really building up that awareness so that we can get to a place where most people are familiar with coaching, and then most people are actually wanting to have a health and wellness coach. And I think when someone knows what it is, they want one. And then it's just working with the healthcare industry to also help them understand where and how the health and wellness coach sits in that conversation as a part of that multidisciplinary team. So, and then the access can continue to grow. The reimbursement piece of this, I know, is a part of the conversation here in the United States, at least. The way that the healthcare professionals and the healthcare systems can get support for the professional roles that exist is to bill an insurance provider a lot of the times. There are other ways to make this work. You can get private funding to have health and wellness coaches on staff. There's also ways to bill for other services and hire coaches in. So there are several models that exist right now, but most healthcare systems will want to understand, can I bill for this? And if so, how? And so NBHWC has been a part of conversations over the last years. In 2019, the American Medical Association continued to approve those CPT-1 code or CPT-3 codes. I apologize. We want CPT-1 codes. Maybe if I speak it into the universe, it'll happen.
Yeah, it'll come back. It'll listen, and then it's just going to happen miraculously.
Yes. But we have the CPT-3 codes, which are for data collection. And then we're also in conversations with the Centers for Medicare and Medicaid to talk about G codes, which are the parallel codes for that type of insurance. And so when we get to that point where we have approval for these codes and they can start to be utilized more widely for billing, that will open up a lot of doors as well for more systems to say, okay, we can do this. We can bring a coach on because now it's billable. And so that's part of the advocacy work that we're continuing to do as an organization through our board commissions. And the staff are reaching out to employers, kind of build connections, trying to understand which insurance providers are currently actually have some room for billing for health coaching. But people can also use their health savings account or flexible savings account and HSA, FSA. It requires usually a note from the doctor for medical necessity, but those generally can be pretty easy conversation with your provider. And then if your HSA, FSA will accept it, you can go that route as well. And it might help cover the full coaching package, or it might cover partial, but that makes that more accessible. And then I know employers are also trying to help with that accessibility and offer coaching through their HR systems. And so we're also trying to build relationships with HR communities and professionals to build that awareness as well of the benefit of health and wellness coaching so that that can be more widely spread as a benefit. And that's another way to kind of build in that access. If you can get it through your employer, then you don't have to maybe worry about costs at all, or maybe the cost is offset. And so all of these things I think will help with the other piece to really build that awareness. What the work we're doing to try to move that forward, because we know that it is something that needs to continue to grow, trying to find all the different levers that we can pull to help that happen.
And when we look on a global level, the crisis that we're currently facing with health, well-being, all these different topics, definitely mental health. I think if there would be more awareness, or, insurances should have the biggest interest, considering, people get their mental health is declining, or even after a heart surgery, it takes forever because the behavior change is what's killing most people, or bringing them back to the hospital and causing a lot more costs. So is there any research or something, like some statistics that you can pull up and really have these discussions with, for example, the insurance companies, the employers and other companies?
Absolutely. So NBHWC board had actually put together a compendium, and they just did an addendum in 2023. And the compendium brings together over 200 studies about health and wellness coaching inside healthcare settings and how they address and support chronic conditions. And so that actually is a summarization of within these chronic conditions, this is how health and wellness coaching has been beneficial. And so that data can be brought in. And then also in the conversations that we're having with Centers for Medicare and Medicaid, there's some additional data that has been brought in. We have case studies that we can get from different healthcare systems that have stood up the health and wellness coaching. And then a lot of those systems as well are doing their own research. One of the biggest centers here in the United States is the VHA, the Veterans Health Administration. They have a health and wellness coaching program. And so I know they have dedicated researchers as well. And it's amazing to see how much that has really grown within inside the VA, which is a government organization. And so it's incredible to use that information and the data there as well to really show how powerful coaching can be. And it really builds that credibility. If the VA would do this, then there's a lot to that. So Absolutely. There's a lot of research that really shows the foundation. And then there continues to be more research that is being done to help really build that up as we continue to see it grow.
For people interested, is there a certain place where they can go to maybe look up some of the researches?
Sure. So on our website, nbhwc.org, you can find the compendium. Mm-hmm. There's a way to share it here as well, maybe through a show note or something along those lines.
Yeah, I'll add it to the show notes.
Perfect.
Yeah. Mm-hmm.
Okay, great. And then if you have questions about other research that might be going on, you're welcome to reach out. Our Practice and Research Commission on our board is very active in not only looking at the research that's happening around the world, but also kind of driving some of that forward. And so they have published. So if you look at some of the authors on the compendium, you might find other bodies of work that would be related to that. And then you can try trusted sources like PubMed, for example, and you can type in health and wellness coaching and look at research there. I think one important thing to mention when it comes to looking at research is just to understand that certain things are done for a specific reason. And so look at each body of work and kind of build a story from it versus looking at one particular publication and assuming that that is the exact. And that is one of the reasons why the compendium is so important, is it really curates so many different bodies of work to really show that story.
Yeah, and then you can always look in the research papers and where they got their information, where their sources are from, and then just be careful. You might end up in a big, big rabbit hole.
Yes.
Well, at least happens to me quite often.
Yes.
So it seems like there is still so much work for you to be done in that space. I think it's a big growing space at the moment. I come across it more and more, even here in the European Union. It's kind of like it's starting to really pick up and hopefully becomes a very, let's say, profound profession at some point as well. Releasing people just after surgery or after first treatment into, that's what you have to change, and then hoping it would happen. We all know that's not going to be the case for most people. We all do that. We fall back into our old patterns.
Yes.
So what are your best wishes to take the National Board for Health and Wellness Coaching as a big next step?
Yeah. So I'm very excited about some of the projects that our organization is working on right now. We are really focusing on how we can continue to support the board certified coaches as well as those who are exploring the journey. So there are some resources that we've been developing that will become available for nationally board certified health and wellness coaches inside their coaching portal. We're continuing to expand some of the opportunities through the health coach training programs or the CE, so building more relationships there. I'm very excited for the work we're doing on, like I mentioned, on the avenue of reimbursement and really driving that forward. And we know that that is a long process and also lots of conversations and really taking steps at a time. However, it's so exciting to be a part of those conversations, and we're really hopeful that we'll be able to realize success there and continue to move that forward. So that's something that we're really eager for. We also just launched an ambassador program at the beginning of this year and have some amazing ambassadors that are really leading in the field and just trying to help with their support and their leadership really continue to grow the awareness. And so what we're really excited for strategically is to continue to see that footprint of not only people who are aware of health and wellness coaching, but the unique value that a nationally board certified health and wellness coach can bring into that conversation. And so where I see us in 10 years is that health and wellness coaching is a household name, that NBHWC continues to be that, that standard for the field, and that professions are seeking the board credential, and that we can continue to evolve as an organization in the ways that we can. We are a credentialing organization, so how can we evolve what we do and stay within our scope as a credentialing organization to support the profession, most especially the coaches and the community that really exists, because without them, they are who we're here for. And so really kind of building that up. And I would love to see reimbursement as a reality, that the healthcare systems are really integrating health and wellness coaches, that workplaces understand the value of coaching and bring in both health and wellness coaching and business and lifestyle coaching, really bring all that robust support for their employees. And that it is something where if you want a health coach, that there's a way to get a health coach that is accessible, not that it has to feel like it is something, as you mentioned, a luxury where if you have the capital means, you can have a health coach. Our goal here is to have a world where everyone has access to thrive and the ability to thrive through the support and with the support of a health and wellness coach if needed. So bringing that to life took 10 years to get to today, and so much incredible work happened over that time. I think so much can happen over the next 10 years. And I'm really excited to see how we can continue to not only advance the profession here in the United States and around the world, but also to really help people. That's why we're here, is to help people have that access so that they can feel their best and have the ability for that accountability partner through behavior change when needed. And I think that will really help to change our overall wellness as a world.
And hopefully we can get that into schools at some point too. Not just imagine not a school counselor, but also having a health and wellness coach in school available for students starting early so they don't then have to relearn their habits later on in life. I think might be one of the biggest potentials out there.
Yes. Oh, that would be phenomenal.
I see. There's a lot to do still. So how can people get involved with the NBHWC?
Sure. So our ambassador program is continuing to grow. We are primarily working with board certified coaches right now. However, we see opportunities to continue to expand that. If you are interested in what we do and you're not board certified yet, you still can reach out or follow us. You can follow us on social media. You can sign up for our newsletter and just kind of see what we're doing. But we are always looking for anyone who's interested in driving forward a conversation about awareness of health and wellness coaching, case studies. We do focus groups from time to time, as well as have projects where we really love to bring the community in. And so if you are not already following us, we just encourage that and then keep eyes open for these opportunities. We tend to cast it out to all. So if we're looking for a focus group, all the board certified coaches would be aware. We also have some hopes in the very near future to have other ways to bring people into the work that we're doing. And so if you're, again, just follow us on our newsletter or on social media to see more opportunities in the future. I'll put all the information in the show notes of our website, our email address, and our handles so that you can follow along and just continue to champion. You can share what we share on social media as well. And we are always open to just continuing to learn what is needed out there for the field to grow and stay on the forefront of that.
And also, how can people get started becoming a health coach?
Sure. So if you go to our site, we have a section that's aspiring coaches, and that will show you where you can find an approved training program. So what NBHWC has are about 145 approved training programs. I say about because a number we have programs apply, so the number can fluctuate a little bit, and they range from online to in-person, to academic, to private sector. And so you can determine which program is best for you, depending on what you're looking for, if you'd like an in-person experience or not, for example. They all have to meet the same minimum standards and to teach to our content outline. And so they go through an approval process. You would go through the approved training program. Once you complete your program and get your certificate, you would then log 50 coaching hours. After you complete those 50 coaching hours, you then would be eligible to sit for the board exam. We have practice exams as well that you can use some time maybe in between to feel confident in what a board exam experience might look like. We even have one that simulates the testing experience with the timed tests and so on. And then once you take your board exam, you would then be a national board certified health and wellness coach. And from there, you just be required to pay a recertification fee every year, and then every 3 years to get 35 CE credit, which you can take any one of our 600 plus CE courses that we have approved. Or if you take something that is not currently on our approved list that you think would be a good fit, you can petition for that as well to get the credit. And then we have different talks throughout the year that we're calling our NBHWC sponsored CE events. And those are for NBCHWCs. But if you're not board certified yet, if you're in a health coach training program, or maybe even just thinking about whether or not this is for you, there's a small fee to sit for those sessions, but you can do that even if you're not board certified. You wouldn't get the CE credit. However, you would be able to get the flavor of maybe what this could be like. And so that might be a really fun opportunity. Or if you're in a health coach training program now and want to start to just get some of this content, you can also sit for those sessions. And we used to do them quarterly, and now we're doing about 6 to 8 a year. So those are some other opportunities. And then we do have Q&A sessions. If you're interested in just learning more about it, you can also sign up for a Q&A session. Any big burning questions that you have that weren't addressed from the site, or just really want to hear more details, you can hear from our team there too.
Great. So there's good opportunities to get started if you wanted to do that. And I know that now we are moving very close now to the start of the NYU Coaching and Technology Summit. And I know that they're launching their own program now as well. So what are you most excited about this year's summit in New York?
First of all, I'm really excited to meet the coaches that are there. That was one of the best parts for me last year, was getting to meet people face to face and have the opportunity to hear their journeys. So if there's still space to register, encourage people to come to the summit. It's great conversation. The panels are fantastic. So I'm really looking forward to having more of those dialogues and to see really what's evolved in what we know, what we believe from this year versus last year when it comes to technology. And then there's more, I think, focus on health and wellness coaching as well. So that'll be really exciting to have just more dialogue around, how health and wellness coaching is continuing to grow and have an impact. So I'm really looking forward to being grateful to be on a panel again this year at the summit and have some more of that discussion. And I'm really excited for NYU to have launched their program. Congratulations. I know it's a lot of work that goes into building a program, and really excited for that to have launched.
Yeah, and the second day will be a lot about health and wellness coaching anyways. So you'll be probably on the second day then in some of the panels. So if you want to see her, you can still sign up. Before we have to close the session, is there anything that you still want to add, something that we might have missed? Something you might want to say to the coaches out there working on health coaching?
Yeah, I'll just say thank you to all the coaches out there, health and wellness coaches, or anyone who's also coaching in a different capacity, has gone through the training and taken the exams. And I know it's a journey to get to that place and learn so much, and you have so much impact. And so just really grateful for the role that you're playing in being a not only behavior change specialist, but also really bringing this health movement and helping people feel their best to thrive. And so thank you for the incredible work that you're doing to be a part of all of that. And we're here to help drive that profession forward and to support everything that's going on.
Thank you. And I'm sure you can send that message also when you're at the panel at the NYU conference as well. I think there will be more and more of the health coaches also coming to the conference.
Fantastic.
Thank you so much for the session today. It was lovely talking to you.
Thank you. It was fantastic speaking with you as well.
Deanna said something that made me laugh and then kept thinking about. She said, how many of us just mute the device when we aren't complying? I can't get to it. I'll just turn it off. But you can't turn off your coach. Not when someone who actually knows you is on the other side of that screen or the room, about to ask the question you've been quietly avoiding. That's the edge. Not the data, not the nudge, the human who won't let you off the hook. So the question I want to leave you with today, who in your life is the person you have a hard time to mute? And is it a human or a device? That's it for today's episode of The Edge of Human and AI, a Viva la Coaching podcast. If this conversation opens something up for you, the best thing you can do is share it. Send it to a colleague, a client, a fellow coach, anyone who's asking the same questions you are. The more of us standing at this edge, the better the conversation gets. Follow us on your favorite podcast app so you never miss an episode. And come find us at vivalacoaching.com, where you'll find resources, community, and conversations you won't find anywhere else. We'll be back next week with another voice from the edge. Until then, come stand with us at the edge.